Good morning, I'm Adam Sexton. Based on the current COVID-19 numbers, the governor of New Hampshire is saying July and August could be relatively calm on the pandemic front in the Granite State. But he is worried about back to school and September and October. So we're going to talk to a doc. Backed by popular demand is Dr. Antonia Altomare from Dartmouth-Hitchcock in Lebanon. Thanks for joining us, doctor.
Thank you for having me.
So what's your medical opinion of this message from the state right now? Do our current new hospitalizations and rate of new positive tests make you cautiously optimistic, or as optimistic as anyone can be in a pandemic for at least the next couple of months?
Yeah, I think, as I've said before, it's so hard to predict a situation that's been largely unpredictable. But I think, as our numbers have shown, our cases each day are getting smaller. And I think overall, more importantly, the percent positivity, so the number of cases actually turning positive out of those that we're testing on a daily basis, has really come down. So I think, we're following the trend that we were hoping for. And the question is what's going to happen come the fall.
And the state has slowly reopened over the last 6 weeks, and we haven't seen much of a dramatic change in the trend line of the curve of the pandemic. What's the explanation for that?
I think people have been really good about the social distancing, so maintaining a 6 foot at least minimum between person to person and wearing masks. And although things have started to open up, I think people have been a little reluctant, although I've noticed some more hustle and bustle. People really are wearing masks when they're out. They're really not having large congregate settings. And I think, time will tell as more things open up and more people start gathering in large groups, whether we're going to see an increase in cases.
And on the why of where we are, is this all attributable to just being good at social distancing and having the luck of a lower population density, or are there aspects of the viral behavior here that could be related to the virus that we don't yet understand? How much of that could be a factor?
Some of it we had hoped would be as people become exposed, we become immune and we develop this herd immunity, but there's still so much unknown about whether those who have been infected or exposed have that ability to not get reinfected. So I really think it's hard to know what other factors from a virologic standpoint are at play here, other than the fact that we've been good about staying home and staying out in public, because really we've had no other real interventions that have come along yet other than supportive care and some antiviral treatments. But from the preventive front, it's all been good hand hygiene, masking, and social distancing.
I know you, the last time we talked to you, you were interested in the serologic studies that were going on, antibody studies. Has any more been learned on that front that is helpful?
So we are doing a bunch more serologic testing, so testing populations for the antibody. And we know that these antibody tests are fairly good. However, they're only as good as the number of people in a population that have been exposed. So it's really hard to understand the statistics behind it. But when you're talking about a setting where very few people have actually had the virus or been infected, the positive predictive value, or the ability to discern whether that positive is a true positive, is more likely to have a true positive, a false positive in those populations. So right now the state and Dartmouth-Hitchcock, we're testing in various places, are really trying to kind of lay the groundwork as to how many people in our population have really been infected, so that we can have yet another tool in our toolkit as we move forward to really reopening, and particularly looking forward to schools opening in the fall.
We're going to get to schools in a minute. I just want to ask, though, and one of the mysteries that we've all been grappling with here, something that the HHS commissioner brought up at a recent press conference. She was saying it's very puzzling how they'll have in a long-term care facility someone who contracts COVID-19 and the case becomes fatal, and then as they've tested everyone within these facilities, they find that there are other people within the at-risk age group who contract COVID-19, and yet they are asymptomatic. Is there any more understanding, or what's your take on that mystery aspect, that one person in that at-risk group can die and another one has no symptoms?
Yeah, I think that's what we're still trying to really understand, is what is the scope of symptoms in this disease? Because what we're finding is we thought there could be mild symptoms. The majority of people have very mild symptoms. But now we're finding, could there actually be a majority who have no symptoms at all? And I think that's what broad testing is finding, more and more people who really had very few symptoms, if any. And we're finding the same with that antibody test. So the percent positivity is correlating with the number of people we've actually found active infection, along with those that have actually had prior infection.
spoke. There's obviously been a lot going on in our communities with mass protests. Would you be surprised if there's not a corresponding increase? It just seems like it has to be a given that there's going to be some viral transmission or spread related to a large community gathering like that.
And I think we're actually starting to see that, or at least there were reports where the National Guard have now had several people who have become positive after attending or trying to facilitate these protests around the country. So one would think that if masks aren't being worn and there's close contact between people, we may in fact see an uptick related to these mass gatherings.
And Hampton Beach is open right now. I think we have a Skycam shot. I'm not sure if we can take that or not. You know, there's a lot of people out there. Is it a concern when you see, and you know, it looks like people are trying to distance and do as best as they can to keep apart from each other. But as we see the openings, is it helpful at all that this is outside, or is it just, you know, this is a potentially dangerous situation that there are a lot of people on the beach?
So I think it's most helpful certainly being outdoors and in the open air. You just don't want to be in confined places. And I think if we are with groups of people who you have always been cohabitating with, it's safe. I would certainly say that you want to stay distanced from people that you're not normally around, maintaining that 6-foot distance. And certainly if using common facilities like restrooms or going into restaurants or other closed indoor spaces, then to certainly wear a mask at that time.
Let's get back to a point you were talking about earlier, the back to school that's going to come sooner than we probably expect. I can't remember the last time I got sick from going to a restaurant or a big box store, but I do know, having a first grader and a kindergartner, that I can count on probably once a year contracting an illness that has come home from school. So it does seem like there could be a boost from this virus if kids are back to school in September, October.
Yeah, I think we're all a little concerned about the coming fall for a lot of reasons. I think there's actually quite a few downsides of our children not being at school, but there's just as much risk, certainly, of infection spreading, any infection for that matter. I think the key points are going to be not attending school if ill, and I know the state is going to have thorough guidance with details on how this may look going forward, whether it's part virtual, part in person. I think hand hygiene is going to be key, and it may be the fact that students may have to wear masks. I think that's going to be really difficult, but that may be the reality. The other big thing that we've been pushing hard is this year more than ever, influenza vaccination is going to be super important because influenza, corona, they all present the same. If people start becoming ill, we're not going to know. You know, we're going to have to deal with people becoming really ill in normally what we see over a flu season, and on top of that, people certainly becoming ill with coronavirus and seeing an increased spike there. And that's what we've been trying to avoid in order to kind of avoid the overwhelming of the healthcare system. So flu vaccination this year, and just being diligent about washing hands and staying home if sick.
Do we know more yet about the multi-system inflammatory syndrome that we're seeing in the very small number but unfortunate number of children who are contracting this very severe complication from COVID-19?
So we do know that this is similar in ways to a syndrome that we have seen in children before called Kawasaki's disease. And I think we're concerned that that in and of itself is precipitated by a virus, and typically an unknown virus. And I think we're seeing the same thing here. And it's supportive care to get them through this super inflammatory response. And so we have anti-inflammatory medication that's being studied in children now to see if this has any effect on that disease going forward.
And as you advise or talk to parents and teachers, it sounds like it's probably something of an epidemiologist's nightmare to say, hey, try and enforce social distancing on a kindergarten or first grade classroom. It's got to be difficult.
Yes, and as a mother of 2 children who are not good at that, it's really hard to keep kids apart.
So herd immunity, this is something we talked about last time. You know, it was a very blunt term at the beginning of this. People were like, gosh, we can't just jump into this. But as we move on through the months, how much closer are we going to get to something like that? And what do you think could come first, the vaccine or something closer to herd immunity?
I think what we're learning with our serologic testing that there are a lot fewer people that have become infected than we thought, and we have a long way to go before reaching that herd immunity naturally. So my hope is that a vaccine will be available long before we cause that herd immunity to happen naturally, and we'll be able to bolster the amount of people who are actually infected and hopefully immune. Again, we don't know at this point whether infection actually means that you are immune and cannot get this again, and that would be the key piece of data that we're still looking for. And the other thing is we need a certain amount of people who are amenable to getting that vaccine in order for it to really work on a population level. So when available, it's going to be really important to kind of understand those factors and what that means for really getting people out safely into society, at work, and into school.
Yeah, what will an eventual vaccine rollout look like? It's going to take quite a bit of time. It's not like everyone's just going to line up at the doctor's office and get this, right? This is going to would take weeks to months to administer, correct?
Yeah, I think we had a similar situation back when we had the H1N1 initially arrive, and there were mass vaccination clinics that kind of happened all at the same time. We're actually planning for such a thing now, kind of thinking of the operational needs and how we get our entire community vaccinated. And we'll be structured similarly to how we do our flu vaccination, although we probably do want to get it into a tighter schedule and get people as immune as possible as quickly as possible.
All right, Dr. Antonia Altomare from Dartmouth-Hitchcock, thanks again for your expertise and your insight. We appreciate it so much.
Thank you very much.